Dr. Concetta Tomaino is a pioneer in the field of musical therapy. She's internationally known for her research in the clinical applications of music and neurological rehabilitation. Her work has been featured on national programs including 48 Hours and 60 Minutes, and internationally on BBC. So we're in for quite a treat.
Wow, you were actually working with one of the leading protagonists of music therapy in the world. And his book, Musicophilia, he dedicated it to you. What is music therapy?
Music therapy is the clinical and evidence-based use of music interventions to accomplish individualized goals. And it's most often done in an individual session, one-to-one. It's always done by a credentialed music therapist.
Okay. Doctor, could you cite an example without using specifics, obviously, but I want the audience to really understand the kind of cases that you're able to try to treat with this therapy?
I think your listeners would be familiar with Congresswoman Gabriella Giffords. When she was injured from a gunshot injury,
I remember that, yes.
She completely lost her ability to speak. And she was working with a very well-known speech therapist, speech language pathologist, but she was also working with a music therapist. And in singing the words, and it was to a popular song, Girls Just Want to Have Fun, she was able to get a sequence of words out in the lyrics. And that was her first stepping stone to recovering speech.
Is it language dependent? Can the therapy still work on someone who's...
Sure. Well, any of the Asian languages or any of the languages that are heavy in sound, where sound is really important to the nuance of what the word means, they actually have better enriched networks in speech. So, any music therapy that's done is going to be sensitive to the culture and the development, because we're talking about human development and brain development in an individual. We're not globally making assumptions about people in general. So each person has their unique response.
Now, is there a workup or something you have to do to connect initially with a patient?
Oh, sure.
There is.
Oh,
so there
absolutely.
are certain things that are going to drive you in certain areas before you can even begin to treat somebody with.
Well, it depends on why the person is being referred to music therapy, and what the goal is. So you can imagine for a young child, it may be behaviors or maybe social isolation and maybe communication skills. For a senior, it may be that they're starting to lose their memory and they want to enhance that as much as possible. If they have a neurologic disease like multiple sclerosis or Parkinson's or had a stroke, then that first assessment is going to help us decide what role music is going to play in their recovery or in their quality of life or in their overall wellness.
And would that also mean the type of music you would use?
That's right. So whether it's going to be a song, like an actual piece of music, if we're working on memory and recall, or if it's going to be an improvisation in the moment to see if we can get that person to emote themselves, express themselves a little deeper, or if it's going to be a rhythm that's played on a iPad or something, or on a drum to see what stride length or what a good healthy step or walking tempo for somebody with Parkinson's is. So in that initial session, we go through all these different stages of evaluation. Can the person hear music? Some of these diseases, the perception of rhythm breaks down, or the perception of pitch breaks down. So we need to know that they're going to respond to music too. This was a woman who had a particular tumor that was causing different kinds of dyskinesias, very irregular, uncontrollable movements. She had tardive dyskinesia, so her tongue would protrude. Some of it was because of medication. Some of it was because of the tumor. And the unfortunate thing with healthcare, people providing direct healthcare, many times when somebody isn't verbal or can't make themselves verbally understood, which she couldn't do because of her speech impairment, they assume that the person has dementia and doesn't understand. And so they treat them like they don't understand what's going on. They do things to them, but not with them.
And I would see this and I would get frustrated because I knew that Maureen not only could participate very well in music, but when she participated, you could tell and actually evaluate that she was fully cognitively intact. Nothing wrong with her speech if you could disengage the dyskinesia. And so by having her sing and sing in a very sing-song, similar to melodic intonation therapy, but in a very time-ordered fashion, in a very melodic fashion, she could speak. And so what I would do is take her back after a session to the unit, to the charge nurse, and I would have Maureen tell the nurse in this sing-song way what her name was, who she is, what her room number was, what she likes about where she is, what she doesn't like about where she is. And the nurse's face went blank because she just assumed that this woman had severe dementia.
That's very interesting also. Clyde and I did some work with the Lexington School of the Deaf years ago. It was the early 2000s, right, Clyde? I think it was.
That's right. Yes, yes.
And they were doing a study at that point where they were able to prove through our programming that the deaf could feel vibration and react to dance through
Absolutely.
vibration. We actually sponsored a show that it was a study that culminated into a show at their theater, which was donated by Ralph Lauren and his sons, his daughters, I should say. And they were amazing. They were able to feel a vibration, and they were treating some of the deaf with music
Right.
and the vibration.
Well, when I mentioned Clive Robbins, Northrop Robbins Music Therapy, his work with Carol, his wife, was at the Rome School for the Deaf. When he came to the States, that was one of his first jobs. And what they found was that, when the child is born with a hearing impairment, they don't totally lose all perception of sound. Like you said, they definitely respond to vibration, but there's frequencies of sound that they may respond to. And what they did, Carol would do these sessions where she'd have the children turn their back to her. And of course, the floors had a lot of vibration to them. And she would play a high note and low note and have them move a certain way depending on what frequency they felt. So was it a fast frequency or a slow frequency? And believe it or not, some of these very young children actually enhanced their perception of sound early on. If there wasn't total nerve damage, there's some children who can hear pitch, and that's because of certain nerve damage. But in these children, their pitch enhancement was improved so much that they actually had a band, and these children played wind instruments. So now with the advent of cochlear implants and other things, of course, that enhances the learning even more. But the idea is that, or at least now we know that because the brain can be enhanced and these networks can be enhanced, if a child is exposed to an enriched environment that targets in a very specific way sound and the nuance of sound, then even the deaf, I can't make a generalization, but there's the potential for an enhancement of that child to be able to hear these nuances.
Are there many children involved with music therapy now? Is it helping a lot of children?
Oh, absolutely.
Really?
The whole field of cochlear implants and language production, there's music therapists working with those children specifically, and there's been many research papers. Music therapists who work in all areas of language acquisitions for children who are language delayed. And then you can imagine some children who have sensory integration issues, where the mapping of sound to action hasn't really taken place yet. That's one of the reasons why language is delayed. In fact, there was a great study by Nina Kraus up at Northwestern in Illinois, where actually showed that children who have language delays actually have poor rhythm perception. And so you can imagine speech is a rhythmic activity. And if you can't process or hear where those changes in between words and in between syllables happen, you can't pick up that pattern of sound to even learn the language. And so there's been, these wonderful programs that introduce rhythm patterning perception in children who are language delayed.
Now, does it work in reverse? I mean, music therapy seems to work for someone that has Alzheimer's, but can music be used in reverse where listening to music can prevent you from getting these things?
That's a hope. There's no definitive studies, but there are studies that show when your mind is actively engaged. So there have been some studies that show a decline in the advancement of cognitive decline. So
yes,
I'll give you an example. I did a study a long time ago, back in 1994, that New York State funded through its dementia grant projects. And we had people at Beth Abraham in the nursing home who had very severe cognitive decline at that point. We had them in a 3-day-a-week music therapy group to use music as a way of enhancing reminiscence. And by the end of 10 months, their short-term memory actually went up. So here are individuals who were institutionalized, whose memories had really declined rapidly, but yet this active engagement in something that was meaningful, that held their attention, that enhanced the executive, frontal part of the brain, actually improved their attention so much so that one man who hadn't recognized or hadn't said his wife's name in a couple of years actually called her by name when she walked into the room.
Beautiful.
For the first time.
Beautiful.
An absolutely fascinating field. And it must be challenging to keep up. There must be daily changes and advances.
Oh, all the time. That's
going on.
That's why my institute's here. It's the most exciting thing for me, because in 1980, when Dr. Sachs and I were trying to find answers and trying to understand why music therapy works so well, we couldn't find an answer. There was very little research that could help us brain research. There was clinical research, obviously. But now the field of cognitive neuroscience and perceptual neuroscience in relation to music has grown exponentially. There's congresses all the time now online that show these mechanisms and show literally brain images of networks changing in the brain because of this. It's the most exciting thing. In fact, the evidence base for music therapy is so strong that NIH had a meeting. This is something that Renee Fleming has gotten involved with. And we had a hearing, I was there too, a hearing at NIH 3 years ago, basically to present to the scientists who had all these different institutes what we know about music and therapy and health and brain health. And the scientists were there and the clinicians were there. And, there's still not enough research. The research needs to be enhanced, but a foundational amount of research to show that this is worth funding and this is worth further explorations to have these collaborations around the world where neuroscientists and clinicians and physicians and nurses and everybody are talking to each other. So the promise and the potential of music therapy for every single person becomes a reality. So one of our struggles now is the fact that some insurance companies cover for it. Some school districts, their special ed divisions may pay for it, but the potential for music therapy from early childhood development into old age and health and wellness for seniors wanting to age well, the potential is there, and it should be made available to everybody who could benefit from it. But the only way that can happen is if the government says, we're going to add music therapy to our insurance, professions that can be billed and reimbursed. In New York State, music therapy is part of creative arts therapy, so we can get reimbursed under mental health by insurance. Yes. But in hospitals, some of the pediatric hospitals, almost all of them will have a music therapist because it's so crucial for pain management, for helping the children heal after surgery, just through helping them with stress reduction and pain management so they're not over-medicated.
So music is medicine in a sense.
Oh, it's more than that. Music is essentially part of who we are. Sound, vibration, rhythm,
Yes.
time.
Yes.
The fact that it's an art form is an extension of human expression.
Yeah, I was about to go into that with you now because, of course, we are involved with the Josephine Foundation, which believes strongly in the performing arts, in the development of young people and the development of human beings. It's not just about the academics. It's about the arts, allowing them to find their gift and bring it forward and give them confidence and learn how to work with other people and
Yep.
all kinds of wonderful things. Do you see a place, or how do you feel about that? Actually, I feel very strongly about it. I talk about it all the time. I'm 40 years pushing this thing about performing arts and the importance of balance in the schools, where we have academics and we have things like performing arts that will allow the kids, but it's the first thing that gets cut in the programs.
That has to change. It really does. And it's interesting because the United Kingdom just published a big thesis on making the arts part of their healthcare system. You know,
Nice. Yeah.
Because a lot of medical issues are related to stress, are related to lack of socialization, whatever. And having access to the arts allows people to interconnect, to form communities. You know, the art in and of itself brings people together, but making art and experiencing music and sharing music and any kind of art, you need more than one person to make it a piece of art, right? And so it begs that people are connected and social and find the similarities and the differences and share it and appreciate that. In early childhood development, what's really interesting, that there's been studies that children who had music lessons at an early age, when they get older, their ability to hear voice in noise is stronger than other aging people. So, you know, when seniors start losing their hearing, they can't distinguish a voice if there's a lot of people talking at once. They can't hear what somebody's saying. But if that person was a musician or had studied music at an early age, and they didn't even have to be a professional musician, there's studies that indicate that their ability to hear voice in noise is enhanced throughout their life.
Absolutely incredible. The stuff.
And
another question I want to ask you also: can an 80-year-old brain develop new networks, as you talked about?
Absolutely. Until the day they die.
Get out of here! Wow.
Oh, absolutely.
So it's almost like it's a bypass of the old system. If you could make
No, it's an enhancement of the system. You know, so just like, you know, there's things that I don't know if you can erase a lot, but it's not like a hard drive. You can think you lost something. I mean, some people do unfortunately lose function because of a traumatic brain injury, and there's enough damage that keeps those areas from working properly. But there may be ways to compensate for that, because there's networks in the brain that will share some of those activities or processes. And if we can enhance those remaining structures and processes and networks, then it's not really bypassing, but it's enhancing. It's like rerouting. Something, you know, like you have a street that needs repair, and you reroute it to a couple of more streets so you can get to your end destination.
Science is fascinating.
A large number of veterans struggle with post-traumatic stress disorder and traumatic brain injury.
In the beginning, when we started the group, it was a true music therapy group. It had a lot of therapy goals, working on self-regulation, emotional resiliency, trust of other people. But it's really, at this point, a way of supporting their self-expression, their creativity, and giving them a purpose to get out every day and to be part of the community.
I was really sad. I had nothing. and the music just ignited something.
The person with PTSD is sort of bombarded by a lot of different thoughts and intrusions about their safety and about their belonging. And it can cause some people severe anxiety, becomes something that's sort of ringing in the back of your head, you know.
There's often a real detachment between their feelings or their ability to really be in touch with their feelings. And you can't heal or you can't recover if you don't know what it is that's blocking you. And so many times those emotions that are inherently expressed in the music can be used as a catalyst for discussion and bringing those personal feelings up to the surface.